Hey guys, this is Malki Assad and welcome back to the channel. Today I'm excited to have my friend Dr. Firas Bahdi as my guest to talk about his experience matching into internal medicine. His journey started from Syria to Cleveland Clinic to UCLA, and now he's a PGY2 resident at Baylor College of Medicine. Welcome Firas to the channel.
Hi, Malki. I'm glad to be here and congratulations on this impressive channel you've been having and then all the important resources you're providing to many IMGs who are trying to find their way into residency in the US.
So I want to start by asking you about your medical school experience and how you start preparation for your USMLE journey. Some students start early in their medical school while others start late. Can you tell us about your experience and how that influenced your preparation for this long journey?
Sure. So I did my medical education at the University of Aleppo, where you did your medical education as well. I always knew that I wanted to come to the US to seek residency. Midway through my medical education, I was extremely interested in internal medicine, which helped me, figure out what specialty I want to seek. And then toward that second half of my medical education, I started preparing for my road to the US residency.
Awesome. Do you think that the ranking in your school plays any role into matching into residency?
The absolute ranking may not be that influential, though, it's sort of reflective of your overall performance, which in many cases is reflective of your USMLE's performance and then your overall success into residency, but it's not an absolute marker to success to get matched, for example.
Yeah, I think I agree with that because I've heard from several attendings that when they assess your CV, they look for a track record. And if you perform consistently high, that means that this is not an outlier. A good score is not an outlier, but it's consistent with your overall performance.
Totally agree.
So regarding your school materials, if you know early on in your school that you want to come to the US, would you recommend focusing on the STEP materials or also studying your school materials?
I was doing both. So, trying to prepare for our own curriculum and then studying whatever equivalent book especially for the USMLEs, either in basic sciences or in clinical education. And it's helpful, I think. It would double up the amount of knowledge you're reading, although it's going to take you more effort. And then on the other hand, it will increase your performance at your school as well, using the USMLE books as a resource.
And any tips for those who have the English as not their first language or they don't study medicine in English?
Well, it's always a good time to improve your English fluency by getting extra courses. Either if you haven't had that chance before starting your med school, it's never too late. And it's all about the fluency rather than the accent. We all have that, and even if you believe you're intermediate or slightly advanced, you can always optimize your English fluency, which can be even more helpful.
Awesome. Now I want to move on to STEP preparation. After you graduated from school, or maybe you started during your school, how did you start preparing for the exams? Did you prepare for step 1 before step 2? And do you think that was the right decision to do or not?
Well, it's a tricky one. I started with the step 1, and then I was preparing it toward the end of my medical education. It was the last year, mainly while I was doing my core electives. And right after graduation, I took my USMLE Step 1. It's controversial because during your last 2 years in medical education, most of your materials and exams and electives are more relevant to Step 2. While, if you do Step 1, it's still helpful, from the pathology wise, from the pharmacology, but it's not going to be that relevant as Step 2. So doing it the other way might be as well right. I'm not sure if there's right or wrong answer, but then if you're doing Step 1 while you're doing your basic science materials earlier in your medical education, that would be as well helpful. And then you can do Step 2 toward the end, and then take it first, and then take Step 1 later on.
And Did your preparation for step one before step two helped you in step two preparation?
Yeah, it made it way easier. You already are more like 2, 3 steps ahead in terms of being very familiar with all the medications and their side effects, pharmacology, and then also with micro for ID stuff, and then pathophysiology. It makes things way easier. So it doesn't take that much time to review step two.
And I heard from several students that if they started early preparing for step one and they were taking these basic science courses in school, that they want to wait till they take the clinical so they can get a better idea of how to answer even step one questions. So if you started preparing for step one during the first 3 years of your school, would you wait a little bit to get a better clinical idea of the materials before you go and do your step one?
Yeah, I agree. It's a two-edged sword, but you can still use those basic books for while you're studying your first, you know, 2, 3 years of your medical education. But then save the question banks, which have more clinical content, toward the maybe the midway through your medical school.
And as you know, there are endless number of materials for studying for both step one and step two, especially step one. There is 100 books for each subject.
Yeah.
What would you recommend studying for? What the materials that you used for preparing the step one?
So step one specifically, first aid is the Bible, and then UWord, and the more questions you do, the better. I use Kaplan books for during my medical school for general concepts, and then focus mainly on first aid. And the more questions you do from UWord or other banks, the helpful it is.
So we both took our exam when step one was a numeric score, 3-digit score. And this was a main selection criteria when they select applicants. Do you think preparation strategy should change or will change when the step one becomes pass fail?
I think so. We used to prepare a lot to make sure we have a very good score. Now that we need to pay more attention to our research activities and then other clinical experiences. So might focus on getting it early and then pass it, of course, and then focus on the other part of your research and clinical experience.
Yeah, I totally agree with you, especially that several studies, and I made a video about that, what program directors look for after step one became pass fail. It turns out that the majority, at least till now, believe that step two will become the new step one. So I don't recommend neglecting step one because the information in there will help you to get a good score on step two as well.
I believe so. So, I'm not very, I didn't read a lot about how things are going to move forward, but I agree with what you said.
During your preparation for the exam and the numerous materials, even if you bring them down to few books, is there any tips that you think helped you get the great score you got, and what things you recommend applicants to do when they're preparing for their exams?
Overall, being organized and have a plan and have a date of when you're going to take the exam, and uh, be like flexible, and then at the same time determined on how long is it going to take you to finish each part of your preparation. Not to waste too much time. Many people like just start and then never end their preparation. It's always helpful to have a deadline because that would force you to get things done by that deadline. And then the more questions you do, the helpful it is. And then try to invest most every part of your day to the best you can, either by questions, reading something, and then watching some videos. And then the more you do it, even if something sounds redundant and you've done it, you've already view that video, for example, it's still helpful to have the idea consolidated again into your brain.
Do you have any strategies that help you memorize things, or you just repeat it? Some people like to take notes, draw pictures. Did you use any specific strategies for that?
I didn't have any specific one. First aid has a lot of mnemonics, which are very helpful. You have to memorize them some way because frequent, reading. But I didn't use any flashcards or anything else.
Now moving on to your clinical experience. After you finished your step, you did some clinical experience in the US, and I think you did some before. Can you tell us a little bit about this clinical experience you had?
Yes. So before graduation, I had the chance of doing an elective and as well an observership. And following my graduation, I took the step one soon after graduation and then focused on having clinical observerships while preparing for my step two. And they were helpful getting more familiar with the US health system and then also having exposure to different institutions and as well to specialties in the US.
Can you share with our viewers how they can get such kind of clinical experience? Do they just apply to programs? Do they have it on their website?
So it takes, both patience and then, sending a lot of emails. I remember for my elective, I've sent over 100 emails to many institutions around where my part of my family is here in the US. And then I maybe got like 2 replies only. And then those were helpful at the start. And then later on was doing the same. But then it opens up doors gradually as you get your first experience, you get to introduce to someone and then or a friend, and then you can have that friend helping you establish an opportunity for an observership somewhere else. So it's both you seeking it and then also a connection.
One thing to mention here is that many programs require applicants to have step one when they apply for electives. So just consider your timeline and what your plan is if you're planning to do electives, to have step one before graduation, because most programs will only allow current medical students to do electives.
Yes, and then another thing is that it takes time. Like, don't assume you're gonna apply and then get the observership or the elective starting in a month. It takes like maybe 3 to 6 months, sometimes even longer, especially with the process to get you onboarded. So apply early.
Yeah, that's a great advice. Did you see any difference between the duties that you have as an electiver versus an observer? I know as a resident, you get to interact with a lot of medical students who do electives. During your observership time and elective time, what was the main difference between these two kind of clinical rotations?
So obviously the difference is hands-on experience and the autonomy. Like you feel, I appreciated both opportunities. You still learn from both. During the elective time, I felt I had more exposure to the system, knowing what barriers you can face and then how to overcome those and being better prepared for residency. Observership, on the other hand, still offers you the clinical experience, but then maybe you're not. It's not a very good, experience for day-to-day or logistics when getting things done especially during residency when you're later gonna start.
So in a few words, in elective, you get to have hands-on experience, while an observer, you get to learn, you get to see, observe what the team does, but you don't get to examine patients, write notes, put them in the medical records.
Yes, absolutely. And then, but even if you're an observer, you still have you can write the notes. You can maybe while the team is around you, when you're shadowing either the fellow, the attending, you can still see the patient with them and then, write your own note and practice it and then present the patient somehow. You're not allowed to examine the patient, but then that's the limiting factor. But it's still an experience. If you try to focus on every opportunity you can invest into, you'll get rewards.
Did you do an observer or a clinical rotation in the institution you matched at? And do you think that helped you in any way get higher chances of matching in that program?
Yes, I did an observership here and before, and it gave me the opportunity to be familiar with the program and made me like it even more, even as a medical, like before applying into residency. And then at the same time, I believe it's helped. And then at the same time, I enjoyed Houston, and then the overall experience at the institution and seeing all the residents and the breadth of the pathology and everything I've seen during my observership.
And were you able to secure letters of recommendation from your observership? I know it might be harder to do that. So did you have the chance to get letters of recommendation during your observership time?
I did, and it's not from all the observerships. Factors that play into role are the duration and then your performance over this time, and then the type of interaction you're having with your attending. It's more clinical, and then you trying to seek the opportunity. It's not about showing up every day and then just walking with the team. You can show up your overall performance by preparing for whatever homeworks you're given, and then trying to find yourself more things you can do during the observership that can be helpful by going to noon conferences, morning reports, and then trying to interact with everyone, and then contribute during rounds. Those are stuff that you can do to optimize your chances in getting a letter of recommendation out of that observership.
And as you know, many students try to get clinical rotation with private doctors. Do you think there is a difference between in the importance of doing a rotation observership at big academic institutions versus private clinics?
Sure. Yeah, there's definitely a difference, and then more. Even if you get a letter out of it, the value of the letter from a big academic institution is more than a small private practice. But as I always say to many friends who ask, the best opportunity is the one you have in your hand. If you don't have the opportunity to get into a big academic institution at the first time you're doing observership, having a smaller one might still help or open up doors into other opportunities. So don't focus a lot on like mainly I'm going to do it in a big academic institution, or I'll never do it. Try to get whatever opportunity you have. The better it is, the more helpful, of course, but don't focus on a few institutions.
That was a great discussion about the clinical rotation, and now I want to move on to research. Can you tell me a little bit about the research experience you had, which institutions, for how long did you do
I had a
research?
total like a year of clinical research before starting residency, and it was between Cleveland Clinic and UCLA. And my role in both of them was as a research assistant. And I never had any research experience before starting that this experience. So it started by step picking up the whole concept of clinical research, and then how to start a project, and then required work. Most of my initial duties included helping with data collection, and then later on was able to have help contribute to projects, and then write articles, and then you have still, as I mentioned, as you're doing your any experience, you have to invest more effort, and then try to learn how things are done. Your people are going to help you learn how to do basic stuff here and there, but then you have to have the curiosity, how are they doing this, and then try to learn it on your own, and then show up and then do more work, and then get more publications out of things you're doing.
You mentioned two great points here. The first one is that you don't have to have research experience prior to starting your research time, because this is the reason why you're doing it, is to get research experience. So don't feel afraid. I get so many students that ask, is research experience a must before applying to a research position? No, it's not a must. There are so many people who will help you. There are research fellows, there are residents, faculty, and they're all there to help you get more research experience and know how to do things. The second point, which follows on the first, is you have to invest the time. If they see someone is doing their tasks, they're giving the time and effort, they will be more happy to continue helping you and supporting you.
Another thing I want to add is being committed. So in a way that, if you're done with the USMLEs before starting research, that's a big plus, and that's the best way you should start research, because you don't want to be just showing up half of the time while you're preparing for your USMLEs. You need to be committed. That would help you both being productive and then also getting a strong letter of recommendations toward the end as well.
That's a great point. I made a video specifically about the idea of studying with research, because it can definitely increase your productivity if you don't have anything else to do. While if you have exams, your mind is not focused on research. This is other than the time you're more worried about your exam. You're focused on your exam. You don't want to invest as much time as you want to do for the exam. You want to give less time to research, more time to do your exam. So there's pros and cons for every choice, but I and Firas both finished our exams before we started our research time to optimize our productivity. So how do you think your research experience helped you in your matching?
Well, it helped a lot. And then one is with the actual research part and the publications. And then two is the experience overall, which is something we might not have that exposure into our medical school a lot, and which helps into residency. And then third is letter of recommendation you can get out of this experience. And then connection with the place you're doing the research or whatever other people you work with as well.
And that will help you if you want to come back for fellowship after you're done with your residency. You already have established connections. And research is very important to get fellowship. So you'd be well prepared when you start residency to do some research projects. While if you don't have any research experience, it would be hard with the clinical duties to start learning about research and start projects during the limited time of internal medicine residency.
Yeah, that's absolutely true. And I'm interested in gastroenterology, so I always focus on getting the research in that part, which is something maybe I didn't highlight before, but then focus on doing research in an area you're interested in the long-term career.
So in general, would you recommend medical students applying to the MASH to do research between their graduation and their first day of residency?
Sure. You don't want to have a gap of your timeline just waiting around for interviews or flying around for these interviews. It's always a good time to still continue to your research. It will help you as well on your subsequent fellowship application if you are applying to fellowship later on. And then at the same time, no one can guarantee their chances into residency season. So that will still ensure that you're still continuously optimizing your application, getting more experience, getting more publication. You can be flexible during your research time, maybe more than into, having more other clinical experiences. So you still have the chance to do the interviews. And now with the virtual setting, it might be even more easier.
And when you were doing the interview process and till the time you started your residency, were you involved in any research?
Yes, I was. I was involved in research at UCLA, and then between that time, between the interviews and then also my clinical research, you always have time to work between those interviews, and then you can organize your schedule and your calendar based on these, and then most of the mentors may be flexible in terms of understanding your schedule as well, and then organizing your work as well and helping you.
Awesome. Now I want to move on to the matching process, the interviews. I want to start by asking you about the selection of program. On which basis you selected the programs you applied to out of the hundreds of available programs?
Well, and this question is important. It varies from an applicant to another. For me, factors that played a role is one, I knew I wanted to do fellowship, so a program that optimizes my chances to getting into GI fellowship is a must. And then on the other hand, I reviewed all the programs available on the ERAS site and then looking for this criteria. Another thing is IMG friendliness, and then as well as places I have ties to in terms of location or family or friends. That's another thing. And then you can always divide your programs into like buckets of, top ranked or impressive programs, and then very good, and then good programs. So at least you have that you make sure you have a good, safety net, just in case things didn't go as you wish.
I always see applicants ask for a list of programs other applicants apply to. And I think based on what you said, this is not the right way of doing this because every applicant has different CV, different scores, different connections, different ties. So I think the best way of doing this is looking at the programs yourself, see where you know people, if they have similar scores, lower, higher than the ones you have, research, if they're looking for research experience or not, they require visa or not. All these are very important factors in deciding which programs you want to go to. And again, the first factor you mentioned is what are you trying to do afterwards? If you're trying to get into a GI fellowship and this program has never graduated somebody who went into GI, probably this is not the best choice for you. You should go somewhere else. The same for cardio, or if you're interested in rural areas, rural service, that also can change your choice of the program.
Yeah, I totally agree. You need to be realistic, and then at the same time, not copying someone else's list or based on just because they're IMG and you are. Each applicant is different in terms of their experience, their score, their ties to the cities, and then you should build up your own list and never depend on someone else. The better you review all the programs and then figuring out whether they suit you or not is key. So put that effort early before application season.
After you selected your programs, how did you start preparing for the interviews, and any tips regarding the interview process?
So regarding the, after you submitted your application and then now you're preparing, waiting for your interview invitations. Well, first thing is being familiar with your application and everything you wrote is key, because that's going to be helpful to prepare for the interview. Doing mock interviews, especially if you didn't have any professional interview experience before, and then prepare for the common questions you can face on an interview, like weaknesses, strength. And now with the virtual setting, you need to make sure you have a good internet connection, having a good computer, camera, and these kinds of stuff. You don't want those to be a limiting factor in your interview experience. And at the same time, being organized in your calendar when you're getting those invitations. You don't want to overbook a day. And at the same time, it would be a good time to initially wait, but then later on try to see if you can make use of any connections or friends you have during your experiences before applying for residency to optimize your chances of getting interviews.
That's a great point, and I also wanted to ask you about that specifically. How important do you think it is to communicate programs you're interested in before the interview, and also the post-interview communication of thank you or expressing your interest in the program?
Well, experiences vary in this area. It's better to communicate that interest in advance when you were doing maybe the observership or the research at that institution, if you want to specifically show your interest for that institution. On the other hand, sending those letter of interest emails, I'm not sure if they're going to help. They might at a few places where you have ties and maybe you're living in that city, you have friends or you have cousins, and then you already had an experience there that you still want to show up the interest. But sending mass letters of interest emails might not be that helpful. On the other hand, still trying to, after you interview, make sure to ask about their post-interview communication policy. Few institutions are clear discouraging any communication, and you need to comply with these policies. On the other hand, if they didn't, then it's nice to send a post-interview email expressing your gratitude for them inviting you to this interview, and then continuous expression of your interest in that program. And it's the more succinct the email is, the better. And as well, if you don't know whether they have any policy or not, then you assume that they don't have any policy against post-interview communication. So go ahead and send something.
I totally agree with you that the experiences vary in regarding the benefit of pre and post interview communication. I think if the program does not have anything against the communication, it might be helpful to do that, especially for programs you're interested in. But what I would recommend doing is doing a specific individualized email to that program, not just a generic one that you send to every program. So people can know that you're really interested in that program. You're not just sending the same email to 100 programs, because they know it's easy to send emails. So, but if you invest the time to know about the program and express your interest in the program, that might be more helpful. As Firas mentioned, there are programs who are against sending this post-interview communication. So be careful that you comply with their rules. In plastic surgery, for example, we have a rule for all plastic surgery programs that applicants cannot send these kind of emails. So just comply with the rules and make it more individualized and specific to the program. So in general, what lessons have you learned from the whole interview process, and anything you'd have changed or improved on for your preparation for this whole season?
Well, first of all, enjoy this whole experience. It's really fun, and to go across and meet many people, and then getting to know different cities and different programs and institutions. It's a fun time. So enjoy it rather than being stressed about being perfect. And then um, simple lessons is whenever now with that's virtual, you might not have that issue, but before having someone checking your email when you're on flight or something, just to make sure if you get any invitation during that time, and then having some safety days between flights just in case anything happens. So I had like uh, some flight delays that interrupted few interviews. So those are basics lessons that I learned, but then overall it's a very joyful and fun and rewarding experience to have.
And we want to replace now the delay in flights with being late on Zoom. So always be careful to be early on time. Uh, turn off all notifications on your laptop, any distractions, so you can be fully focused on the interview.
Yeah, absolutely. Especially like, it's these are the interview professionalism skills that everyone should show up in terms of attire, time wise, being punctual. And then it's, if you're on time, you're late. So make sure you're early, and at the same time, uh, uh, being receptive to, other people, and then being interactive, and then, keeping good eye-to-eye communication. And then because nowadays with that limited physical interaction, and then body language, you should make sure you don't have any, you still have that part of the professional interaction even when you're doing virtual meetings.
That was a great discussion regarding your journey, step preparation, clinical experience, research, and the interview process. Finally, I want to move on to ask you a few questions regarding your residency experience. Can you tell us a little bit about how the first year was, how your expectations met reality, and what did you learn from the first year of residency at Baylor?
Well, that's a very big question. First of all, everyone's going to be anxious before starting intern day. And things you can do is to, hit the ground running is maybe preparing step 3 just to refresh your clinical knowledge, and then having all the required tools that how you have, make sure during the pre internship orientation to have all the access and the stuff needed to be ready on the first day. It's a fun time, Intern year may be hard. You still gonna learn a lot. It's a very steep learning curve, regardless of your prior clinical experience. Uh, show up to work, being always on time, being excited and curious about learning stuff. Those will take you long, and then they will you might not notice it early on, but then you will feel it toward the mid of your intern year when you believe you're more competent than when you started your intern year. At Baylor, it was a really interesting year. Intern year is usually more clinical heavy, and compared to the second and third year, but it's very rewarding. You feel toward the mid of your intern year very competent with the exposure you had across the various institutions and we have in the clinical settings, and then at the same with the breadth of pathology you see. So overall advice, show up on time, be passionate about what you do, and be excited to learn. And these will take you long, and then trust the system. Most of the times the system will gonna teach you a lot. So, and everyone is gonna struggle the first week. So don't worry about that. Anytime you have before intern year, maybe enjoy it with some vacation, doing something fun, because once you start, you might not have that flexibility.
I'm sure your first year was full of excitement, especially with COVID and everything that was happening around. What was the thing that helped you the most during your first year, and what things could have been done to prepare you better for this experience?
So things that helped me was, maybe taking step 3, as I mentioned before, starting intern year, and then showing up early, and then trying to, figure out the best way to be efficient, and then you might have it take more time than other people to do the work, but the more we practice, the better. And I still mention, trust the system. You're gonna learn it one way or another with the clinical load you're gonna have, and then you have amazing upper levels, and then attendings that are passionate about helping you, teaching you, supporting you, which I was blessed with during my intern year. Everyone, specifically here at Baylor, they are amazing. They grab your hand from first day if your seems lost, and then they will give you the advice, and you're gonna do the same when you become second year. Don't get me wrong, but it's that experience and the camaraderie among the program that also help makes intern year easier, and still fun building up these friends and during that time.
Awesome. So in general, be prepared, have a good medical knowledge, be hardworking, and people are there to help you.
Yeah, I agree. And then people appreciate hardworking people. And then, as I mentioned, it's not there. The expectation is not about how good you are when you start. It's about your improvement along this intern year, and then being receptive to feedback and continuously working on the areas of weaknesses. Those are the key strength of any resident, rather than expecting yourself to be excellent from first day. That's not realistic. And other things you can do is to, beside preparing clinically, is as well being other thing that can help as well is having either the advisors from the program or upper levels that you enjoyed working with, that you can ask them during your intern year about any feedback, and then that can help improve. Sometimes you don't notice yourself doing something either wrong or not the inefficient. So being open to advice and ask for it is also another helpful thing.
Well, that brings us to the end of this informative discussion with Firas. It was a pleasure talking to you and discussing your journey. Do you have any additional thoughts on this experience and matching into Baylor and residency in general?
It's a great pleasure to be here as well, Milke. Thank you very much. I enjoy your videos. They're very helpful for many applicants. And as I mentioned many times already, I think I use these words a lot so far. Enjoy it. Be hard worker. Be helpful to others and appreciate help from other people, and be transparent and be honest with everyone you work with, and in terms of expectations. And then don't try to commit to stuff you cannot deliver, and be open to feedback and advice during your career, and keep up the good friends you gain along this track, and then enjoy it. And it might be to have a good fun spirit while you're doing it as well, just to release some of the stress you might have during this preparation and then later on your career.
Thank you so much, Firas, for your time. If you like the video, please subscribe to my channel. And if you have any questions, you can leave them in the comments below. Thank you everyone so much for watching, and see you in future videos.